Welcome back, everyone. We are continuing along with the different parts of the skull, and in this short video, we're going to be looking at sutures and sinuses and parts of the cranial floor and cranial vault. So, in this particular view here, this is a bird's eye view looking down. Right? You're above the individual looking down. So we're looking at a superior view. And right here is the nose, right? So that means this is anterior. And back here, this is posterior, okay? This is their left side, and this is the right side because they are looking at us. So we have a few sutures. And this is where bones come in and join to fuse. Now, when I say fuse, when we're living, they're not completely ossified and glued together. There's a degree of expansion and movement that take place here, but it's very minimal. It's not like a freely movable joint like the shoulder, the wrist, or the elbow, but there's about a millimeter of movement and expansion that takes place here. Okay, so this line that's going this way, that separates it to a left and right half, that's your sagittal suture. This one going across is your coronal suture. So the coronal suture separates the frontal bone from your two parietal bones. And then towards the back, we have a lambdoidal, like lambda, 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 right? There's the lambda suture that separates the occipital bone from the two parietal bones, right? So the parietal bones are paired. There's a left and right, but there's one frontal bone and one occipital bone. And this is what it looks like on a skull, right? So the way we're going to show it may be like this illustration, and then we're going to show the same thing on these bones. So again, sagittal suture, coronal suture. You could see the nose here and a little bit of the eye orbits. So little perspective. Okay, now we're looking at, the hint here is the posterior view. So we're looking at the individual from the back. So this is the occipital bone. And then here are the two parietal bones. We could see from the posterior a little bit of the sagittal suture. And now here we could see that really jagged looking lambdoidal suture. From the posterior, we could see another suture right here on this side, and that's your squamous suture. We can see a little bit from the posterior, and when we rotate the skull to the side, we'll see it more from the lateral perspective. So again, we have your sagittal suture, and we have a lambdoidal suture. And a little bit from the side here, we could see a little bit of the squamous, but it's best if we rotate it from this side, which we can see now. Here, this is the temporal bone, and there's going to be a suture that separates the temporal bone from the parietal bone, and it is this squamous suture that we can see right here, okay? Sorry about that. Let's see if I can. Okay. All right, so what else do we have? We could also see from the lateral view, there's your coronal suture. And then from the posterior, right back here, we could see a little bit of the lambdoidal suture. All right, what are some other bones that are the giveaways here from this perspective? We have the frontal bone, the occipital bone, parietal bone, temporal bone. Here's your jaw, that's called a mandible. And here, I really like these pictures because the different colors are telling us that they're different bones. Once you see, you know, this pink color, and then you see this purplish, bluish color, these are two different bones. So this one here is the sphenoid bone. And we could see the sphenoid bone from the lateral view. We can see it from the front if we're looking at them heads on through the orbit of the eye. And we can also see it when we cut the skull this way and we remove the cap of the skull and we're looking inside, we can see part of the sphenoid. Okay, so usually I refer to the sphenoid as the butterfly bone or the bat bone because it has wings like a butterfly or wings like a bat. So again, from this view, we can see the coronal suture, squamous suture, lambdoidal suture. And then right here, this is that sphenoid bone. So I'll put a S here for sphenoid bone. We'll put a P for parietal bone, frontal bone, temporal bone, and occipital bone. And we'll put an M here for mandible. Up here, the upper jaw is the maxilla. Okay. And this is what it kind of looks like with an infant or a baby, still same bones, but we notice that there's no fusion here, right? Because the bones haven't fully developed. So when a baby comes out of the birth canal, we know, ooh, be careful of the top of the baby's head. There's always a soft spot. But really, if you palpate and put your hand on the top of a baby's head, you can feel pulsing. You can feel a beating. And that's really the pulsing of cerebral spinal fluid. A lot of osteopaths, or those that are osteopathic doctors, or they abbreviate that as DOs, right? When you go to your physician, sometimes you'll see MD for medical doctor, sometimes you'll see DC for doctor of chiropractic, and sometimes you'll see DO for doctor of osteopathy. Osteopaths, many that do manual medicine and do osteopathic manipulation, work with that pulsing of the cerebral spinal fluid, and they call it the craniosacral pump or craniosacral therapy. It's a pretty neat concept. When we're looking at a baby, right? So here's that, they call it a frontal suture. They don't call it a sagittal suture in a baby, okay? Okay, we're gonna look at the paranasal sinuses now. When we look at the nasal and paranasal sinuses, things that are around the nose, there are these chambers or cavities that are located within. So we can see some of these sinuses from an anterior view, and we could see some from a lateral perspective. But on this view, if there was an X-ray taken, here is your frontal sinus. This is the eye orbit. This is the left maxillary sinus, but notice it's a sinusitis. Doesn't this chamber here look different than this chamber here? This is a normal right maxillary sinus. This one is congested with fluid, so they call it a sinusitis. So here's the cranial cavity, and when we look at it, this is now cutting the skull, right, in this sagittal perspective. When we open it up, we can now look inside, so we can see these different chambers, right? Here's the frontal bone, and we see here, there's a frontal sinus. Here is the sphenoid bone. We can see a sphenoid sinus, okay? Those are those little openings, those chambers. So when we open up the skull, here is the cranial vault or the cranial cavity. This entire opening right here is the cranial vault or cranial cavity. When we look at the skull from this perspective and we look at the floor of the cranium, we can see these main bones again. We see the ethmoid, the sphenoid, the temporal, the temporal bone, and the occipital bone. And then what we see here, these are other important landmarks that I will be covering in other videos, and they're really important, but these landmarks are found within the sphenoid, right? So the foramen magnum is part of the sphenoid. The foramen ovale is part of the sphenoid. The carotid canal is part of the temporal bone. So I'm going to show you these landmarks on a larger scale. So when we take the top of the skull and we remove it, this is looking down on the skull. This is anterior, and back here is posterior. This is the individual's left, and this is the individual's right. So we have an anterior cranial fossa, we have a middle cranial fossa, and we have a posterior cranial fossa. Those are the three main divisions. Okay, let's take a look at some of these cranial bones here. Some of the main cranial bones. In the front, we have the frontal bone. Sometimes they call it the frontal squama, but let's refer to it as simply the frontal bone. Okay, let's remove squama here and just let's refer to this as the frontal bone. This specific region right here is called the glabella. And then this here is the supra means above the orbit, so supraorbital margin or supraorbital ridge. I like to call it the supraorbital ridge. Okay. In the eye orbit, we have the lacrimal gland sits right here. The lacrimal gland is producing tears. That's what the lacrimal duct does. So the lacrimal duct produces tears, and those tears are going to flow in this direction and eventually drain into the nose. So there's a depression here called the lacrimal fossa. The lacrimal fossa. When we look at the bone itself, here is the frontal bone. Let's remove squama and call it the frontal bone. Here's the supraorbital margin right there. This is the supraorbital ridge right here. Here's the glabella right in the center. That's the glabella. And here's the lacrimal fossa. Again, it's a smooth depression, and that's where the lacrimal gland is, and it produces tears and then flows in this way. And eventually all the debris is going to go into the nose. What ends up happening is you have a histamine reaction in the nose, and the histamine makes the tissues around this and this swell up. When it swells, you get that, right, that clogged, stuffed nose type of feeling. When we look from the sagittal view, this right here is the frontal sinus. There's that chamber. When you breathe in air and air comes in through the nares, through the nostrils, in here we have an inferior, we have a middle, and we have a superior nasal concha. We have an inferior, a middle, and a superior nasal concha. Sometimes these concha are called turbinates. And in the word turbinate, we see the word turbine. Okay. And a turbine kind of is like a spiral, right? That's what a turbine is. So when you breathe in air, these turbines or these turbinates spin the air or centrifuge the air as it's inhaled. And because we have mucus that lines this the nasopharynx back here, this nasal cavity, all the debris is going to stick to the mucus. And as you breathe in the air, centrifuging and spinning the air is going to warm the air as you breathe it in. It's going to moisten the air as you breathe it in, and it's going to clear any debris. Okay. Between the inferior, middle, and superior turbinate or concha, there is a meatus. There is an inferior meatus, a middle meatus, and then there's the superior meatus. That's just the space and gap between them. When we look from the anterior view and we look in the nose, the only turbinate or concha that we can see are the lower two, the inferior concha and the middle concha. We cannot see the superior concha, right? It's obstructed, it's blocked. Okay, from the side view, here's our parietal bone. From the back view, we can see the occipital bone as well as the two parietal bones. On the skull, here's the two parietal bones. And let's not forget what we've learned: sagittal suture, lambdoidal suture, occiput back here. Again, from the side view, here's the parietal bone. Here's the temporal bone. This is the squamous suture. Here's your frontal bone. And here's your coronal suture. Here's your sphenoid bone. On the occiput, when we look at the occiput from the posterior, we can see that there is an EOP. Now, you can't abbreviate, so what does EOP stand for? It stands for external occipital protuberance. This part really sticks out. Everyone can palpate the back of their skull, and you're going to feel a little circle back there. That's the external occipital protuberance because it protrudes. Okay, and then we have these lines. Here's a superior nuchal line, and then here's an inferior nuchal line. These superior and inferior nuchal lines, as well as the EOP, are attachment sites, especially for muscles like the trapezius has attachments to these landmarks. Again, we could see the squamous suture and we can see the sagittal suture. On the skull, here's the external occipital protuberance, EOP, that's back here. And again, we can see the superior nuchal line and the inferior nuchal line. Nuchal, it looks like neck, nuchal neck. When we look at the occiput bone, the occipital bone, from the inferior perspective, we could still see the external occipital protuberance, and then here's the crest, the external occipital crest. Here are the occipital condyles. The purpose of these condyles is that this is the articulating surface for the skull to attach to C1, which is also known as the atlas. C1 is the atlas, because the atlas is the Greek god that holds up the world. The world is your skull, which holds the brain. Okay, so these occipital condyles, right, they're nice and smooth, and they're this convex shape. And when you nod your head, just nodding, yes, not using your neck for flexion and extension, just nodding your head, that is and taking place between this joint, between the atlas and the occiput. And here on the skull, right here, is the occipital condyles. Here's the external occipital crest and the external occipital protuberance. When we look from the lateral view, now we can see the temporal bone. Everything here, this is all temporal, right? Everything that's that red pinkish color, that's the temporal bone. So there is a squamous portion. There is a zygomatic process. Sometimes this is simply referred to as the zygomatic arch. Everything in here, the zygomatic arch. This part of the mandible is the mandibular fossa. The fossa is this cavity or that smooth depression in which the mandibular process, which is here, is going to fit in. Let's see if I can erase that so I can show it a little bit better for you. Okay, let me bring the pen back. Okay, so this is the mandibular process, and it's going to fit in the mandibular fossa. And the joint, when these two meet, is what we refer to as the temporal mandibular joint, or TMJ. You ever hear someone say, oh, I have TMJ? Everyone has a TMJ. Everyone has a temporal mandibular joint. What they mean to say is they may have a temporal mandibular joint dysfunction. Okay, so what else do we have? This is a mastoid process, and this is an important landmark because there's a muscle called the SCM that's going to attach there, the sternocleidomastoid. So the SCM muscle attaches to the mastoid process, and then there's a thinner process called the styloid process. Okay, when we look on the skull, again, here we're still looking at all the different structures off of the temporal bone. There's a squamous portion of the temporal bone, the zygomatic arch, which is this. There is a mandibular fossa, that's the female end. Okay, so the mandibular fossa is the female end, whereas the mandibular process is the male end. And there's a perfect articulation between the two that creates the temporal mandibular joint. Okay. We have the mastoid process. That's the larger one. We can all feel that on the side of our skull, but the styloid process is deeper. It's harder to locate that, to actually feel it. The temporal bone, looking inside the cranial vault, right? Looking in, we have the petrous portion of the temporal bone. And that's this, all of this mountain that we see here, that's the petrous portion of the temporal bone. Really important part, because if you could lift this up and away, there's a very important structure that lies deep to it. And it's part of the ear. It's the part of the ear that deals with the hearing and deals with the balance. Okay, so we can see the vestibular and the cochlear portion of the ear that's hidden in this. And if you look at an illustration of it, or you look in your lab book or textbook, it's going to look like a snail shell. That's what we're going to see, especially the cochlear portion for hearing. But the balance center, which is called the vestibular portion, also lies in here. So when people have vertigo, when they move their head and they feel like this spinning effect, there's typically something going on. If it's positional, right? They call it benign paroxysmal positional vertigo, BPPV, benign paroxysmal positional vertigo. This is very reproducible. You know, a patient turns their head to the right and everything spins. Patient moves their head up and back and oh, they get so dizzy, everything is spinning, the world spins. Those are fixable, takes about 5 minutes. I fix these all the time in my office without drugs or motion sickness medication. As long as it's reproducible by a specific head movement, it's treatable in 3 to 5 minutes. There's something going on with the vestibular canals, either the anterior, the transverse, or the posterior canals inside the ear. When we look at the skull, there's the petrous portion. And again, here's the squamous portion of the temporal bone. Now, here's shouldn't say temporal bone. This is really part of the sphenoid bone right here. So this that looks like a bat, like the wings of a bat or a bird, okay? Here is the lesser wing of the sphenoid, and then here's the greater wing of the sphenoid. And then right here in the center is what is referred to as the sella turcica, which means Turkish saddle, sella turcica or Turkish saddle. And there's a very important structure that sits in this fossa. Let's see if I can erase that. There's a very important structure that sits in that fossa. Let me make the pen, let's make it green here. So right here is a gland that's called the pituitary gland, and the pituitary gland sits right there. And you see these holes, one here and one here. You're going to have the optic nerve that travels through there. One goes this way, goes back to the brain, and then the other comes through here and goes to the back of the brain for vision. This is why when that pituitary gland has tumors or it becomes larger and hits the optic nerve, which is cranial nerve 2, there can be visual disturbances, blindness in specific parts of the eye. Okay, but you have a lesser wing and a greater wing of the sphenoid bone. Okay, so let's take a look, see it's properly labeled here, sphenoid bone. This is the lesser wing, here is the greater wing, and here is the sella turcica, which is the Turkish saddle. Now there is a fossa that's here. So the pituitary gland sits in this fossa called the hypophyseal fossa. Hypophyseal. It's Hypophyseal. Hyphyseal, hypophyseal fossa. And this term hypophysis means pituitary. Okay, so the hypophyseal fossa is the actual depression within the sella turcica for the pituitary gland to sit in. And the reason why I want to teach you that term, hypophyseal fossa, is when you get into endocrinology in A&P2, you are going to learn that the pituitary has an anterior pituitary and a posterior pituitary. And the anterior pituitary is called the adenohypophysis, and the posterior pituitary is called the neurohypophysis. So knowing that the term hypophysis from hypophyseal fossa and being able to correlate that with the pituitary gland is an important concept. When we extract and take out the sphenoid bone, again, you can see the wings. There's a lesser wing and there's a greater wing of the sphenoid. The other important structure that I want you to know there is the pterygoid plates. And there is a medial pterygoid plate, two medial pterygoid plates, and then a lateral pterygoid plate because it's more lateral to it. What's the significance of the medial and lateral pterygoid plates? There's muscles that are going to attach there, and they are the chewing muscles. We call them muscles of mastication. It's the temporal muscle, the internal pterygoid, the masseter, and the external pterygoid. Now, the other name for internal pterygoid is medial pterygoid, and the other name for external pterygoid is the lateral pterygoid. So they're interchangeable terms. So the external pterygoid muscle is going to have attachment on the lateral pterygoid plate, and the medial pterygoid plate is going to be the attachment for the internal pterygoid muscle. Okay, the P is silent, pterygoids. The other two muscles of mastication, this means chewing, is the temporalis muscle and the masseter muscle. Okay, here's the sphenoid sinus, right? We did the frontal sinus here. Here is the sphenoidal sinus or sphenoid sinus. From the posterior view, we can see this and this. We could see this and this. These are the pterygoid processes. You have two medial pterygoid plates or pterygoid processes, and then two lateral pterygoid plates or pterygoid processes. I like to refer to them as the pterygoid process because really it's an extension for muscles to attach to. Okay, here is the ethmoid. Everything that we're looking at here is ethmoid, and we can extract this out from the skull to get a better look at it. But here we're looking at the nasal cavity, right? There's the hole for the nose. Down on the bottom right here is something called a vomer. Now, the vomer is continuous with this structure called a perpendicular plate. Okay. And the perpendicular plate has an extension that comes up right here at the top called a crista galli. Okay. Now, inside the nose, again, we could see those nasal concha or nasal turbinates. Here is the inferior nasal concha. Here's the middle nasal concha. Remember, I said you can't quite see the superior one because it's being obstructed by the nasal bone. But these are those turbines or turbinates that are going to centrifuge and spin the centrifuge or spin the air as you breathe in. Okay. Now, when we cup the skull in this direction, you're going to see a little bit of that crista galli poke through the top, and there's going to be a bunch of little holes right through here called a cribiform plate. A bunch of little holes here called a cribiform plate. And the cribiform plate is part of the ethmoid. The purpose of these little holes called a cribiform plate is that the nerve that deals with the sense of smell is going to come in and perforate through the cribiform plate. And that's called cranial nerve number 1, which is called the olfactory nerve, for the sense of smell. In fact, if you ever have like cold ices or cold ice cream and you drink it or eat it too fast and you get that frozen brain syndrome right between your eyes, it is cranial nerve 1, the olfactory nerve, that's being stimulated, that's producing that type of pain. Now here's looking at the ethmoid bone from the front view. So again, here's the vomer down here at the bottom. We could see the perpendicular plate, which is just a vertical extension of it. And then peeking through the top is the crista galli. It's like the thing that's on the top of a rooster, that flap on the top of a rooster's head is the crista galli. Here you can see the frontal sinus, and here's the maxillary sinus. This is again from that frontal view. We can also see the inferior nasal meatus, as well as the inferior nasal concha. Remember, the meatus is just that canal, right, that's in the middle here. Now you can see why when you breathe air, it creates a turbine. Here's the middle nasal meatus with the middle nasal concha. At the top is the superior nasal concha with the superior nasal meatus. So perspective and orientation is really, really important. So now what we're doing is we're going to go from here, looking at the crista galli. We're going to look at the cribiform plate, but now we're going to be looking down on it. Okay, so let's look down on it right here. This is anterior. Back here is posterior. So here's the ethmoid bone. Here's the crista galli poking up, and here's the cribiform plate. The cribiform plate is those little pinholes that we see in the ethmoid bone. And the cribiform plate is where cranial nerve number 1, when we talk about cranial nerves, they're always written in Roman numeral, cranial nerve number 1, or the olfactory nerve. When we look at the skull, here's the crista galli, and around it is the cribiform plate. It's going to have all those little holes going around it. Here's the ethmoid bone from a different perspective, right? Looking in the nasal cavity, there's the vomer, which is the most inferior extension. There's the perpendicular plate as we start moving up. That's what we call the nasal septum, right? That separates the nose. When people say they have a deviated septum, that's what they're talking about, that perpendicular plate. Then we have the nasal concha. Here is the inferior nasal concha, and here is the middle nasal concha. We can't quite see the superior because it's too high up, okay? So again, here's the vomer on the bottom, this section. Superior to it is the perpendicular plate. Here is the inferior nasal concha, and here's the middle nasal concha. Superior is higher up, would be somewhere in here. When we look at the frontal view, looking at the front, right, here's the individual's right eye, here's their left eye, here's the ethmoid sinus, that's this one here. Okay, these are the turbinates, right? You can see them from here. These are the turbinates. And this is the maxillary sinus and the other maxillary sinus. Okay, I'll take a break here. When we come back, we'll look at some of the facial bones, the auditory ossicles, and the hyoid bone.